on the dot, 8 a.m. Good morning and good evening to everyone, depending from where you're joining. I'm Dr. Sabahat Ali Zaidi, and I'm your moderator for today's session. The purpose of today's session is to give you a detailed and comprehensive view of what our residency program is. It is a collaboration between Central Institute of Family Medicine and University of Lahore. We've taken up our first batch, pioneer batch, which is running successfully, and they are doing their rotations right now. And our next rotations will start, next batch will start in January 2026. So without wasting any time, I would welcome our speakers. We have speakers from Pakistan and from Canada who will give you a detailed introduction to our program and the PRA pathway and what happens after you land in Canada. So our first speaker is Mr. Irfan Shakir. He has done his MS in general surgery. He has done his MCPS in family medicine, MPhil in public health. He has done his CHPE and DIP in radiology. Currently, he's working as head of the family medicine department at University of Lahore. And he's also working as a surgeon at Evercare Hospital. So Dr. Irfan Shakir takes care of all the organizers and monitors all the rotations taking place at University of Lahore. So without wasting any more time, I would like to welcome him, and he will tell you a little bit about the rotations that are and training at University of Lahore. Good morning, Dr. Irfan. Be joined.
Thank you, everyone. Thank you so much, madam. Thank you, Dr. Nasir. Ma'am, would you please display my short PowerPoint? I can explain according to the situation.
Okay.
Welcome all of you on behalf of University of Lahore for this vast international residency program, which is a collaboration, and we are doing this program with the collaboration with the Central Institute of Family Medicine. So I have a short introduction of my University of Lahore. So thank you all of you on behalf of University of Lahore, as this is a University of Lahore main campus is situated on the Raven Road. It's about 100 acres. That's a area. So if we can see the ranking of this university, about 400 university in the worldwide, and second ranked in private medical universities in Lahore and Pakistan. Sorry. So we are running a different kind of program, about 20 to 25 program, post-graduation program, which are master and fellowship and membership program of the CPSP, and many others, depending upon the specialty of that program. So international affiliation, this university is having a broad affiliation with the nationally and internationally education center like WHO, World Federation, Medical Education Commission for Foreign Medical Graduates, Medical Board of California, Council of the UK, and Overseas Registration Examination with the UK, Australian Dental Council, and American Dental Council Associations. We have vast majority of affiliation with the foreign countries. So international training programs are also we are running in the international, like American Heart Association, that is ACLS and BLS programs. So this is a great picture of during the MOU with the Central Institute of Family Medicine in collaboration with the University of Lahore. Dr. Nasir Shah and Dr. Uzair Rauf were the deputy CEO of this university. So scope of University of Lahore CIFM collaboration is we are offering more convenient and program in the international residency about for the students present in different kind of cities. So we have a different kind of city recognition in the different hospitals in different cities of the Pakistan, and you can um, perform, you can do your trainings in a different cities like Lahore, Faisalabad, Sargodha, Multan, Quetta, Peshawar as well. So belonging student belonging to on those city, they can perform their trainings in these kind of different cities. So we have well-established libraries and the more than 130,000 latest books, journals, and research papers related to all disciplines in University of Lahore. We have we have a faculty proper. We have a department of family medicine and other specialty programs. So head of department family medicine. I'm chairing as a head of department, visiting faculties and different kind of other faculties like a registrar, senior registrar, and postgraduate residents as well. So we have a family medicine team. We have me as a Dr. Irfan, the chairing as a head of department, and Dr. Durehoma, senior registrar, and other registrars, senior registrars, and postgraduate residents and MOs, medical officers, senior medical officers, and registrars are pointing on the different kind of our primary care health centers. Training side, we have different kind of training side like university itself and its affiliated uh, hospitals, and which are primary and secondary care hospitals. And in primary care health sites, we have two different kind of well-developed hospitals with emergency beds and admission facilities, and all those kind of facilities required for the diagnosis and as well as treatment of the patients. These sites are, so primary healthcare sites are, we have a Seth Medical Complex, Hanjarwa, so situated on Chokar Niaz Beg, and Seth Medical Complex, Lake City. We have next, and this is the Seth Medical Complex, Lake City. So this is the emergency of the training site. So our team is working in the Seth Medical Complex. This is second one, Hanjarwala Seth Medical Complex. So healthcare facilities affiliated with the University of Lahore Teaching Hospital itself having a hospital, and next is Social Security Teaching Hospital. We have Social Security Hospital, Code Lakpat, and Al Khidmat Mansoura Teaching Hospital, University Dental Hospital, and Children Heart Hospital. And new hospital we have established at this 2020. So we are going to opening 2026 with the collaboration Noor Hospital of Noor Teaching Hospital of affiliated, which is affiliated with University of Lahore. So this is our simulation centers with different kind of training program like basic life support or trauma life support, BLS, and ACLS. We have programs. So this is a summary of a short introduction with the this university. So university is recognized from HEC and PMDC recognized degree awarding institute, and University of Lahore is Pakistan's second ranked medical university in Pakistan in private universities, and about 400 ranked in international universities as well. So CIFM is Pakistan's largest family medicine training institute. We have collaboration with this Central Institute of Family Medicine. So CIFM is Pakistan's the most experienced institute in flexible training, online educations, practical workshop, training, network management, and good quality and high with the higher education faculties. So University of Lahore and CIFM aim to provide international level trainings at doorsteps. Thank you so much, ma'am. Thank you, all of you, and welcome all of you on behalf of University of Lahore and Department of Family Medicine. Thank you so much, Dr. Nasir, and over to Madam Sabah.
So, thank you so much, Dr. Irfan. Uh, that was a very good presentation and a tour of the university. Now, I would like to welcome our next speaker. Though his name needs no introduction, but still, I would tell you a little about him. Professor Dr. Nasir Shah. He did his fellowship in family medicine in 2002 from Khan University, and since then he has been on promotion of family medicine in Pakistan for more than 23 years. He contributed to Khan University and Ziauddin University in Karachi, Papa Memorial Hospital and University of Health Sciences, King Edward Medical University, Faisalabad University, Shifa University, Islamabad, and Shifa University, Islamabad, and College of Physicians and Surgeons, Pakistan. He has served as head of family medicine at FMH, UHS, and as Dean of Family Medicine and CPSP, and also represented Pakistan in WHO EMRO region, which comprises of 22 countries. He has worked in each corner of Pakistan. He's my teacher, my mentor, so and my current boss also, and I'm very happy to welcome him. So over to you, sir.
Thank you, Rasabah. Why was we a team? Anyway, welcome to all the participants in this open house. I would like to share some light on the program itself. So what the candidates or the trainees undergo during this training program. So this is another picture of University of Lahore. So I'll tell you something about Central Institute of Family Medicine. It's a private training organization registered with SACP. Our main office is in Lahore, but we operate throughout the country through our 100 district chapters where there are chapter presidents and a network of hospitals and clinics throughout Pakistan. So you just don't have to focus on each box of this slide, just focus on the red one. This slide tells us what we do in Pakistan, but the point for your interest is the structured training program, which is one of our programs. So I'll focus mainly on the red box, that is structured training program, which is approved for the international trainings like Canada, Australia. The training program that I'm going to share with you is a very good example of blended learning. Blended learning is one of the latest methods of education. It blends different teaching modalities for the PG trainees. We do not rely on one component. So there are different components of the training program, and all of them converge in better education of the trainees. So on one hand, we have a big online component in which there are lectures and recorded lectures, online lectures, banks of videos and assessments. And there's a big list of 25 workshops related to leadership skills, clinical and procedural skills. And there are workplace-based assessment and reflective learning activities. These are the most important part of training program. In the modern medical education in the United States, UK, each training program must have workplace-based assessments and a lot of reflective learning activities. So our program is the most intense program throughout Pakistan among all the family medicine programs. And then there are ongoing assessments, and every year the trainees undergo an exit exam. So from promotion from one year to the next also needs an exam. So it's a robust mechanism of training for the PGs. And of course, in the right in the center, there are clinical attachments, which are full-time attachments. So just share the rotations, and just to emphasize that these are not fixed, and we maintain flexibility according to the needs of the PG trainees. So before we start, we ask each candidate which rotations you would like to do in your tenure. So we start from the PGs themselves, so that our training is accommodative to the needs of the PG trainees. And this is a glimpse of the workplace-based assessments and reflective learning activities. And we can claim that these are equal to the standards of Royal College of General Practitioners UK, and if not more than them. And plus, we have an additional online case-based discussion, which is one of the star component of the programs, in which PGs bring their cases, and the entire group of PGs with the entire group of faculty, we discuss those cases. There's a very intense learning activity, the online case-based discussions, and the others are tools, internationally recognized tools. And when you graduate, your transcript will mention all these activities, which will make your transcript, in the exit transcript or the details of your training program, a very strong letter telling about each component you have been through during the training program. And supervision is also at 3 levels. Dr. Sabahat is the residency director, and we have one educational supervisor, which is attached with the PG trainee throughout the training program. And on the grounds, those who are involved in teaching, they are the clinical supervisors. Portfolio maintenance is an important component. We monitor the training programs and allow opportunities to add value to your training. Apart from the mentioned activities, you can have more activities as well. So all the joining reports, supervisory reports, assessments, and reflective learning, workshop attendance, rotations, everything is recorded in the portfolio. And that's a proof of your training. I will also show you some of the glimpses of the online educations. So this is the age of technology. So people who do not use technology, usually they are reluctant to embrace the future. So we use a lot of AIs in preparation of the material, and we use online educational banks for teaching. And for example, all the PGs get the login and password for the bank of videos, and these are very interactive videos. So the topics are covered in the online. They can play in any gadgets. We give them the bank of physical examination videos, all the techniques, in the bank of communication skill videos in which they learn communication skills, and we are preparing a book on the communication skills in the 2026. One of our projects is the book of communication skills. And there's a bank of patients with findings, like the old man in black has a positive Romberg sign. Patients with clinical signs of chronic liver disease, thyroid, injuries, all the clinical signs that a doctor should know or may know throughout his lifetime practice, we give them the entire bank at once. And there's a bank of procedure videos in which they teach you the correct techniques so that you can refine your own techniques. And just to confess, even at the time of graduation or the time of training, I also did not know about all the procedures that occur. Like Some people have not seen ETT being done, ECT being done, tilt table test, angiographies. So we share brief 3 to 5 minutes, brief videos about procedures and tests so that you know what these tests entail and you can educate your patients. So this video bank helps in enhancing your knowledge and orientation. So assessments, end of each exam and at end of training, we have MCQ test, OSCE, and we also give importance to the portfolio. Then passing marks in all the activities is 60%. So we have training sites in different cities, and we like to know where you want to do training. There's a current list of secondary and tertiary hospitals, about 15 of them, where we provide training. Holy Family, one of the oldest in Karachi, the training site. This is the old picture of Holy Family. Begum Jahan Hospital in Islamabad, and that is in Kasur. Niazi Medical and Mia Mohammed Trust Hospital. This is in Faisalabad. Let me show you the GP clinics. This is our GP clinic in Faisalabad. Professor Shahmed Shehzad, Professor Basharat is PhD in FRC GP in Gujranwala, Dr. Mohsen's clinic, Shahriar's clinic. So we try to enroll new clinics all the time. Those doctors who are qualified, we have a system of inspections. We go there, inspect, and register their clinics. So currently, we have 2 full-time professors, 1 visiting professor, and 22 adjunct professors, associate professor 1 who is full-time, and 84 assistant professors throughout Pakistan, and 40 senior registrar, and a big bank of visiting faculty members. Those who are undergoing the training programs, they know one speaker is from UK, the other is from Australia, and the third speaker is from Karachi. Just to summarize, this training program is Pakistan's the most intense, aggressive, and updated latest training program. And we use the blended teaching methodologies so that every component is an educational exercise for the trainees. And we have a continuous system of supervision and maintenance of portfolio. And all these are at par with the standards of United States, Canada, UK, and Australia, you name it. And it was a request, but 2 weeks ago we got approval for the MRC GP int as well as the category A eligibility. So thank you. I will take questions in the end when the other speakers complete their presentations. Yeah. So I'll stop sharing. Over to you, Dr. Sabah.
Thank you so much, sir. That was a very comprehensive view of our rotation program, our training program. Now, I can see in the participants, we have one of our current trainees who started his training with us in August, Dr. Mohsen Ikram. So, Dr. Mohsen, I would request you to just turn on your mic and give your very honest feedback on the residency program. Over to you, Dr. Mohsen, if you're there.
Assalamu alaikum, everyone. Thank you, Dr. Sabahat, and thank you, Dr. Nasir. Dr. Nasir, I'm going to be honest. I'm going to start saying that I joined this program because I met Dr. Nasir in person.
Professor Mohsen, your camera.
Sorry, sir. I think I have some technical difficulties, so let's skip camera for today.
I see.
So yeah, the honest feedback about this program, few things that I really like is the flexibility. You should know where you're going and what you want and where you need more exposure. Based on that, you can choose your programs. Also, you don't have to stick to one city. So I like that portion as well. The third portion is they are very accommodative. Our faculty, in my experience, they've been very accommodative. They're very understanding. When it comes to clinic and hospital exposure, it's up to you. If you want to learn, you can learn as much as you want. It's up to you. So it's not, our good old house job days and days before that time, they're gone. It's up to us now to learn and expose ourselves to different situations. So far, I'm happy. I'm pretty satisfied. Our faculty is very helpful when it comes to, like, if you need any help, I don't have to think twice to ask or to reach out. So far so good. Alhamdulillah, no regrets.
Thank you so much, Dr. Mohsin, for your kind words. And now I would request if I can see another trainee who can give their feedback. Dr. Farah, are you there?
I think Dr.
Assalamualaikum, Dr. Sabahat, I'm here.
Yes, Dr. Farah, over to you. Dr. Mohsin is doing his training from Sialkot, actually, currently. And Dr. Farah, over to you now.
Assalamualaikum, everyone, and thank you, Dr. Sabahat and Dr. Nasir, for this opportunity. I am Dr. Farah. I have joined this training since August, and I'm doing my training in Faisalabad. And I would say that at the reputation of Professor Dr. Nasir Shah, it reached us before we met him. And when we met him and his team, they did not disappoint us. I would say that Dr. Nasir Shah and his team, they have the knowledge and the skills to groom you for the position as a general physician that you are aiming for. So I was able to join my training in Faisalabad. My clinical supervisor, who was I was rotating with for the family medicine rotation, he had experience as a general physician for more than 40 years. And truly, I was able to learn a lot from him for so many things that maybe we sometimes skip and we think that we know, but we never practice them. So this is what I learned from him. And then the rotations, the in-person rotations we have been attending with Dr. Nasir, his personal, dedication and the time he dedicate towards all the trainees and everything. So many things that we learned from scratch. And yes, of course, many of people, they had the skills that were polished during these in-person workshops. So I would say that so far it has been a great experience. And since I am doing my rotation in surgery nowadays, so the experience of getting that hands-on experience and all the things that I need to do in the future, because I'm aiming for the practice ready assessment in Canada. So so far, I think my deficiencies that have been there because of the gap in my career, so they have been fulfilled. So I'm really, I feel lucky that I was able to join this program. And I would say that Dr. Nasir Shah and his team has been doing a great job so far.
Thank you, Dr. Farah, for your kind words. Thank you, Dr. Mohsin. I feel so flattered. Now it's time to welcome our next speaker. She is Dr. Ghausia Samreen. She is a graduate from Nasir Medical College, and currently she is working in Lethbridge, Alberta, as family member, physician, and hospitalist. And Dr. Ghausia Samreen will tell you all about PRA. So over to Dr. Ghausia.
Assalamu alaikum, everyone. Thank you so much, Dr. Sabahat. Can I share my screen?
Sure, please.
All right. Thank you so much, first of all, for inviting me to talk about PRA part in Canada. Sorry about the technical issues. I don't know what to do about, but that's finally we sorted out. So I'm Ghausia Samreen. I am a family physician. I'm working in Lethbridge, Alberta. So I'm here to talk about, first of all, what is a PRA? So PRA is a practice readiness assessment process, which is offered by the College of Physician and Surgeon of Alberta. And now in many other provinces, it's also been opened. And this pathway allows you to get an independent license to practice medicine, like a family medicine in Canadian healthcare system. And actually, it bypassed the residency program. Let's talk about, first of all, because I am practicing in Alberta, so we will talk about Alberta. So the PRA pathway, we need what is the eligibility requirements? So we need a medical degree, which is listed in WHO World directly. And then English proficiency exams, and you have to pass qualifying one exam and 2-year postgraduate training. Another way is to get the recency of practice, which is within the last 3 years, you need to have practice independently or being a part of continuous postgraduate training program for a minimum of 1 year in the discipline you want to practice. What is the required training, in which Dr. Nasir Shah, he has already been explained fully, but I will just go through a little bit of about it. So we need the completion of all postgraduate training required for the discipline like family medicine. First of all, it should be university affiliated program, which include 4 months of basics community-based primary care training, 8 weeks in at least 3 of pediatrics, OBGYN, surgery, internal medicine. And other specialties, they need the discipline-specific specialty training equivalent to Royal College standards. With specialist certification, this path is usually for the last line is for the specialist training. They also need the English requirement. And for the English, there are many options available. Like before when I did, this was only the IELTS exams, which was we need to do. That should be within 24 months before you submitting your application for CPSA, in which you need all minimum score of 7 in each of the 4 components. OET is another one which has been introduced recently. And again, it should be in the past 24 months before you submit your application to CPSA. And you should have a grade B in each. And then you have to have, along with that, you need a criminal record checkup wherever you were working in the past 5 years. In the BC, we have another program in the BC too. Their eligibility requirement, you again need all the trainings in all the domains like internal medicine, general surgery, OBGYN, pediatrics, psychiatric, emergency medicine, minimum of 8 weeks of postgraduate training in family medicine. This is again, they need the 2 year of postgraduate training in an international duration leading to the registration or demonstration of completion of the 7 core rotation, which we have mentioned down here. And when we talk about the 2 year postgraduate training, this is really important to know that should not be any gap between the training. Minimum gap is required is only 3 months. If you have taken a gap, it should be before 3 months you should join back. So in BC, they want, BC is basically British Columbia. Sorry, I should explain this before. Minimum 2 year training, academic, then again, you have a medical degree, which should be verified from physician apply, which my next colleague, she will explain to you when you land in Canadian system, what you have to do. And then again, a recency of practice and current CV, fully explain your activities, professional, whatever you have achieved. And then again, they also need the English proficiency exams. So these are the main rotations which you need. The same, this is actually overall is same for all over Canadian system, wherever you go, whichever province you apply. In some provinces, there is just a slight difference. In some, maybe they want 1 month of psych. In other, they want 2 months of psych. And the same is the ER rotation. In some provinces, they need minimum of 4 weeks. In other, they need minimum of 8 weeks. So it depends, the slight difference, but the core is the same. Another new changes recently have happened in the British Columbia, which was effectively from July 7, 2025. They have eliminated the MCCQE1, the requirement for the assessment class for licensure. Applicant may apply for from any country. Immigration status in Canadian system is not required for the PRA BC. But they also need the TDM exam, which again my colleague will discuss about it. There is another program in BC, which is a BC rural program. In this one, wherever you apply in the rural areas, either in Alberta or in BC, you should go all these trainings like ATLS, ACLS, PALS, and NRP. New Brunswick's also another province which has also opened, recently opened their PRA program. They again need the medical education, like the same MBBS, which is registered, the college is registered with WHO, and have a medical degree and eligibility to work, be a Canadian citizen. So they need the Canadian citizenship, permanent residence, or be legally entitled to live and work in New Brunswick. Again, they also need the language exam and English or French. So training and practice experience, they also need the same training and practice experience in New Brunswick. They should complete fully the combination of training and experience relevant to family medicine. Again, the 2 year of postgraduate training, and which could have been again affiliated, and 1 year or 1 year of independent supervised lessons practice, or have successfully completed 1 year postgraduate training resulting in certification. Core rotations is the same as we discussed before, and also have successfully completed 7 core rotation, 8 weeks minimum in family medicine. And again, this is the same which we talked about. Along with that, every province, they also need the good character and the standing certificates, good standing certificates, and which should be, if we are getting the training from Pakistan, so from PMDC, we should need this too to apply for further work for the license. And again, when you are applying, you need the letter of residence, which again I will leave for my colleague. She will discuss more in detail. Manitoba is another province which has also a program open for PRA. And they have actually one program in which the people who fulfill the criteria, they give them an option of 1 year training where they give them the as a resident program for 1 year, and then you get your full license. So in this one, satisfactory completion of 2 years, again, this is another option, 2 year training in family medicine, general surgery, pediatrics, OBGYN. And again, it should be postgraduate training authority, which can give you the certification, or satisfactory completion of 1 year of postgraduate clinical training in family medicine. And again, English is another same requirement for them. Nova Scotia programs again need the 24 months of training in family medicine, and these are the same main core minimum of internal med, surgery, peds, psych, OBGYN, and emergency. So they need actually 2 years of training in family medicine, plus, this is slightly different from Alberta, 2 years of independent practice after postgraduate training. And recency of practice at least 6 months within the last 3 years. Or they also need, usually they do the pre-screening, and then they select, and then you write the exam, TDM exam, which again I will leave for my colleague to discuss. And after this, the assessment program, and about this one, Dr. Sial, she will discuss. Saskatchewan is another province in which there is a CIPA program. Rotation for them 2 years previously, now it's 1 year. So previously they were demanding about the 2 years program, but now they need only 1 year. Again, the same course, 8-week rotation in all these domains, like general surgery, pediatrics, OBGYN, or 3 years of full scope of practice if post graduation training is less than 24 months. Either you have the full training or you have your own practice, full practice in the past 3 years. Again, they need the English exam, 7 score in each, and pre-screen application, TDM exam, and pre-screen and interview and assessment, and 3 year return of service. So when we so these are the basically all these main provinces which are offering for PRA routes. And then for this part, I think I will leave this to Dr. Sayal to discuss about what to do when you land in you land in Canada, and from physician apply to find the job. So there's Dr. Nasir Shah has already been discussed about the whatever the hospital are available, like Fatma Memorial. I did from Fatma Memorial Lahore, and Shifa is also Islamabad, Ziauddin, Dow Medical College, Lahore, University of Lahore, Sialkot, Karachi, Multan, Faisalabad, Kasur, which is actually very privileged now. It's available in many other areas. And this is doctors. Okay, so this part I will leave for my colleague to discuss about it. Thank you so much.
Thank you, Dr. Samreen. Thank you so much for telling us in detail about the residency. And now the next step is the assessment after residency. So that is what our next speaker will talk about. I would like to welcome Dr. Baswa Sayal. She has done his MBBS, LMCC, CCFP. She's a clinical lecturer at Cummings School of Medicine, University of Calgary, Alberta. And she's currently practicing in Alberta as consultant family physician for past 8 years. So, welcome, Dr. Baswa.
Hello, can you hear me?
Yeah.
Perfect.
Welcome.
Thank you so much for your invitation and giving a bit of introduction. I think we're gonna quickly wind up with like continuation of the presentation by Dr. Samreen already.
Okay. You want me to share your presentation?
Yes, absolutely. Thank you so much.
Tell me if it's visible.
Not yet.
Is it
Yeah.
visible?
Yeah, we can see that now, I guess.
Okay. So I'll just keep on changing slides.
So I must share a bit about the introduction given by Dr. Samreen, that she told like in different states, like what's the procedure. Me like being more like working in Alberta and like doing assessments here, probably I would say I will focus more on Alberta program, but I will try to give you a little bit of an overview of also a little bit about like other states as well, like how they are actually looking through the assessments when the candidates enter in that circle. So if you go on my page 1, after that, yeah, so that's typically speaking about like in Alberta how the things happen. I think if you can maximize that, the first step. Okay, so the Dr. Samreen, where she ended is when you get your eligibility letter and you enter in Canada, what are the next steps after that? And that's the main slide that will be focusing more throughout my presentation today. So eligibility letter has certain requirements discussed already by Dr. Samreen. She gave you an overview of requirement in different states. We know like in Alberta, it's 2 years of residency and your qualifying 1 exam and your language proficiency exam, and then you can, and of course a med school degree, and you apply for, you get your eligibility letter. So the college here is CPSA, who will give you, after assessing your degrees, paperwork and stuff, they're going to give you eligibility letter. And that's from where I'm going to start to tell you what will happen. So once you have your eligibility letter, your next step is to apply for exam TDM. I guess like it's now in back home as well, many people doing that. So you can do it back home, you can do it here. That's the same exam. Once you pass it, your next step is to enter in the assessment. And I've shared the books and the study courses offered by CPSA for the preparation for TDM and the assessment after that, the clinical assessment. Okay, so once you get eligibility letter, you apply for TDM exam. And TDM happens 3 times in 1 year. It's January, June, and September. And if you get through that, great. If not, then like you're gonna go the second attempt after the next exam. So it's like you can't do more than 2 attempts in 1 year. There's a bit of limitation in that. And the sponsorship is like while you are preparing for your TDM exam, you need to find the sponsorship. And that's again with CPSA, like you apply sponsorship there at different positions that have been there, you apply there, you get one, and then you enter in the assessment after that. So the process is very simple. I guess I have studied like assessment in different states as well, like the requirements and how do they work and what are they typically looking into. And that's basic things everywhere the same. I think if you're ready for one state, you're actually ready for all for that examination. However, there might be like procedural differences, duration differences, or like different environment that we will be working for. So once you enter in the assessment, it's mostly 12 weeks preliminary clinical assessment or called PCA. And then we have 12 weeks probationary assessment. This is in Alberta and other states as well, with minor changes, kind of like similar things going on as well.
Shall I change?
I would, yeah, if you can go over the last one, there are different, if you go over the last one, so there are different, yeah, if you keep going and you move on to the last slide.
You want me to back this one?
No, the last one. So there are different fields in which the assessment happens. It's in the,
Last
they're gonna
means
assess
final,
you in the,
final last or the previous last? Final
yeah,
one, I think.
you're going right way. So you keep going page 4,
Yeah.
this one,
Okay.
right? So like in like including Alberta, most of the facilities that they will be assigned you to work in, community clinical practice, acute care, working as hospitalist, long-term care, and ER. And anybody can be assigned any place depending on where they have applied for the job. And once you get the job in that particular faculty, you will be assessed accordingly. Say in case if you applied for a job in a rural where you have to work in like acute care and the clinical practice and the hospitalist, you will be assessed in all 3 fields. So your assessment is typically according to the job that you got. So you will be exactly offered the similar environment where you will be working after getting the job. Okay, now we're gonna go back where we were before. So I just shared some resources before. You see the, yeah, exactly the one. So these are the books that are commonly used for the students who land here after like looking for some study material. This is what they gonna look at. So Toronto Notes is basically for all the baseline or basic clinical or medical knowledge. CTC is the book that is used for TDM. This is therapeutic decision making exam, and CTC is the main book for that. And then you go for the assessment, and you see the last one there, Guide to Canadian Family Medicine Examination by Dr. Dash and Dr. Angel, is the one that is recommended in Alberta and University of Calgary for the family medicine residents as well. So we consider that as kind of like standard, and we follow the recommendations given in that book. Yeah, if you go on to the next page. So these are a couple courses that are offered by CPSA before the assessment starts. And they're fairly just, I think I heard a bit about Dr. Nasir, like giving the review of how we are giving training to candidates in different faculties and fields. This is exactly what they're focusing in that too as well, and the areas where you will be assessed once the assessment starts. Okay, the next one. Yeah, so once you start your assessment, you finish, I think number 3. If you can go number 3.
This one?
Number 3, the one that has like flow sheet. I think I got it. This one.
This one?
Yeah, after that. So the once you have like 12 weeks of assessment completed in both PCA and PA assessment, you start working as provisional register, and it's a conditional practice license. Like you have to stay with that faculty and finish your duration of 3 years. It's different in different states that you will eventually qualify for being general register after. And the last slide was according to like it was all about that. I welcome your questions. I guess most of the people probably would be more interested in looking into assessment preparation, but I'm not sure like if any other questions after. I think I explained the basic.
Dr. Basga, you want me to stop sharing?
I think I'm good about the presentation part. I would welcome if there is a question.
Okay.
Assalamu alaikum, Dr. Basga.
Walaikum assalam.
So, Basga, I'm also in Alberta. I'm in Calgary. I have passed by even MCCQ Part 1 in 2009. I passed that, but after that, there was no PRA going on at that time, and we were new immigrant, and I could not go for the residency program. So I just need to know that currency of our, if I have completed all of the exams of Canada, which is already valid. I'm living in Calgary right now. I'm working as mental health consultant since past 7 years here. But I would like to switch my field towards family medicine. So I have to go through just 1 year for the currency of practice, or I have to go through 2 years program? That's my question. Because I saw a couple of days ago, there is a news that Alberta was asking it's 2 years in past 3 years that you have to be in practice for 2 years, but now they have changed that you need just 1 year at this moment.
I think that's the best question be answered by Dr. Samreen, but I believe it's 2 years continuous residency that you need. And if there is a bigger gap, you might need to redo the 1 year. Is that correct, Dr. Samreen?
Yes, absolutely. No, it's not 1 year in Alberta. It's continuous 2-year training, which is required in Alberta.
For the currency of practice?
2 years practice in the past 3 years.
In past 3 years.
Yeah.
Okay, because couple of days ago, one patient came to me and they said, because Alberta is where everyone is so desperate to have the family doctors, they have changed the rule. They have reduced currency of hours. Just 1 year in last
There might
year.
be new things coming, but so far as I know, or like what we know about like their documentation in the websites, we see like it's 2 years.
They have not updated that website yet. So I thought maybe you have more knowledge right now. That's why I said with this home that if you say, okay, 1 year good enough.
The only change for the BC was the new one, which they have eliminated even QE1. But otherwise, this is the same in Alberta, what I know, what I checked, yeah.
I mean, currency of hour is the same everywhere.
Yeah.
Okay, thank
What
you.
about the
Mariam
suspension?
Afani has raised her hand. Dr. Mariam?
Yeah, Assalamu alaikum, Dr. Nasir Shah. He's my teacher as well. Dr. Hosia, my question is that I have cleared my NACOSCI and the next year they just cancelled for the NACOSCI. And now I'm in Ontario and now they are cancelling for the students which are coming, physicians basically, which are coming from international countries. So if they are not done with their high school in Canada, they cannot attempt for the residency here. So I did all like I did my MCPS in family medicine, and now I want to go for QE1 exam. Do you suggest me to do that, or I should go for PRA and go to Pakistan and do my residency and come back? I don't know they will change again or what they will do in the next 2 years.
Yeah, this is the recent change which happened in Ontario, but this is now they have taken the stay. But still, this is in the code, this matter that they banning the IMGs to get the residency here who have not done the high schools from here.
Yeah.
So it's still in debate at this point. So not 100% sure what they will make, but still many provinces still have opening for PRA paths. So I will suggest to pursue that way.
So what you suggest, it's 1 year requirement for me or 2 years requirement? I did my independent practice for 7 years in Pakistan.
But when was the last time you stopped? That's what.
It's more than 3 years now.
So now then you have to go back. Either you have to write to the college, check from the college. If there you get the residency for the 3 months, and then you go back and apply for your eligibility. But you have to check from them, because usually after 3 years, people go for 3 months, come back, do their residency, and then apply again.
And Dr. Wasia, one more question. Should I give my own experience and my like house job certifications, everything to the physicianapply.com for verification, or direct to the province college?
So PRA, for the physician apply, you should give everything that your house job to you, and whatever experience you have to verify it. That's the only way you can use it further down the road for your eligibility.
Okay, actually 2 years is very difficult to go back home with kids.
Yeah.
And 1 year we can manage. Yeah.
That's right. It's not it's not an easy decision to go back years, but that's what we did too. It was a very hard decision, but Alhamdulillah, due to that, we got the training with Dr. Nasir, and now we are sitting here and working. So that's all Allah blessing. But it's a hard part. I totally agree. As a mother, as a wife, it's really hard to leave your family behind and go for 2 years. Yeah. But you
Dr.
have.
Wasia, can you guide us other than this like platform, because you are in the system?
Yeah, sure. Anytime.
Okay. Thank you so much.
Thank you, Dr.
Thanks
Moeen.
a lot.
Dr. Mubassir Ali Akbar has raised his hand for quite a while now. So over to you, Dr. Mubassir. Let Dr. Mubassir first ask, because he's raised his hand for quite a long time. His hand must be tired now.
Hi, I'm so sorry. I was not able to unmute myself. I just have a quick question from Dr. Voska and Dr. Basas here. First question is like you mentioned about the sponsorship. So I'm just wondering, like I got the TDM eligibility from Alberta, but can I secure the sponsorship even without passing the TDM exam?
I guess unfortunately not. So they're actually looking for
Dr. Mubassir, please mute yourself.
Can you hear me?
Hi, yeah, I can hear you now.
Okay, so your question, what I got is like, can you apply for sponsorship when you have TDM? Is that correct?
Yeah, exactly. So I'm just like, I have the TDM eligibility, but I did not appear in the TDM exam yet. So I'm wondering if I can secure that sponsorship before passing the TDM exam.
Yes, you can. Yeah, you can apply for, you can have an agreement, but you can proceed with the assessment after passing your TDM.
Okay. Engineer Wahaj, I can't read your name. You've raised your hand. Yes, please.
Yeah, Wajahat.
Okay.
Sorry, I'm
welcome,
here
Dr.
on the-
Wajahat.
Thank you so much. First of all, I want to thank you all the hosts, and especially like I'm in Alberta, and I'm talking on behalf of my wife. She is also there, Amna Mufti. So we have some questions because We recently moved to Alberta also, and we already
Hello.
registered for the January program. So we are planning to go Pakistan for 1 year. And I double checked the website of CPA that their requirement is like changed in the June. They changed to 24 months to 1 year, and it's showing in their website. And I went to multiple times, and it's correct that they change it to 1 year. And in 1 year, which they have a 10 months rotations. And I discussed with Ishtiaq Saab also when I register for the coming January program for my wife. So I want to make sure that we are aligned and we are planning to come. So can you help to get the good answer for that?
Yeah, Dr. Ghazi, I think that's for you. But like in general, they keep on changing their parameters.
Yeah.
I think you should always be just keeping in touch before you quit your residency. So make sure like you fulfill their requirement before you quit. There might be chances like they're changing it because of a huge like we have deficiency for physicians here, and they have opened the borders for physicians from UK a lot. So we are getting a lot of physicians now in Alberta. There might be chances they're reviewing their policies, and in next couple of years, there might be some new updates. That's a great decision that you're planning to go back. You do that. You start that. But before you quit, you finish your 1 year before you quit, make sure the recommendations are same.
Yeah.
Yeah, sure. That's a plan that I'm not going, only my half part my wife is going. So, but we are able to manage it, and we will check that it's a requirement, because I know that they can't change. They will change the requirement again. Maybe go
Yeah,
back to
I
24
mean,
months. Then we have to change the plan also,
yeah,
because
things change. I mean, there are a few
you
things
are
we can't. Yeah, there are a few things we can't predict. But like taking decision when you are doing it for your family, it's a huge decision. Just keep in touch with the latest recommendations before you quit your residency program.
Yeah, that happened with me.
just
Yeah, when I went, it was only 1 year training program required. But in the middle, I came to know they have changed to 2 years. So then I have to stay for 2 years.
Yeah, that's the example I needed. So thank you so much. And also, like, I want to describe like her background, because we came 9 years ago, Canada, and she left the practice 9 years ago. But from last 3 years, she passed all steps of USMLE 1 to 3 in first attempt, and from last 1 year, she was doing the observation in US. So, and now we came back here because residency we are applying in US also is difficult. Like from last 2 years, we didn't get the response for that. So now, like you can advise on that one also, that so far she did is good, but still we need your advice.
I guess we answered your question. I mean, like to keep checking on to the latest guidelines before you quit your residency program.
Dr. Nasir has his hand raised. Please, sir.
Both hands, electronic and physical. Just to add one important point, this is a major concern of many PG trainees that who have registered for 2 years, and there's a desire among all the PGs to apply early, 1 year or 1.5 year or 15 months, to have the essential rotations, and they start their process of application for the NACOSCI, anti-DM and all the stuff. And at the same time, they continue with the residency to complete it 2 years. So in short, a desire to apply early, start the process, and at the same time to complete the 2 years. So yesterday we were seriously considering that to facilitate the PG trainees and reorganize the rotations in such a way to facilitate the PGs, so that their rotations are completed in such a way that they can apply early for their next steps instead of waiting for the completion of 2 years. So that will be, I think, today we have a meeting with the PGs as well to finalize those things, and then we present to the university, inshallah. Hopefully that will be a big help to all the PGs. Thank you.
Thank you,
Thank
Dr.
you so much. Thank you. Thank you.
Dr. Farheen Masood has her hand raised.
Assalamu alaikum. I'm Dr. Farheen Masood. Actually, I just want to ask something related to PRA. That I'm married, so what about my family? Are they giving some family visa? Or my husband is engineer, so is he allowed to do to apply for jobs in Canada?
I guess we have very limited knowledge just about, like, particularly regarding our own field. We can guide you. I'm not sure about the rest of other like job opportunities in other fields. However, can you explain your question regarding medical field for yourself?
Is it about visa or the job?
No, it's about my family. Like, if I'm applying for PRA pathway, so what about my family? That I can take my kids and my husband there also.
Okay, gotcha. So kind of like when you apply for a job here, it's kind of like you need to find a sponsorship first. So many people, they would come alone, they would settle down, and then they would invite their family to come in. So when you come in, it's not like you right away you become independent on earning. You need a lot of time to spend here first for yourself to get yourself established. So not a wise decision if you move with family and you have no jobs.
Okay, thank you.
Yeah.
Now, Dr. Anila Mansoor has her hand raised.
Assalamu alaikum. Thank you. First of all, I would like to thank Dr. Nasir and all the other faculty members for organizing this program to help us. So my question is for Dr. Basra Sial. So as you said about the assessment fields, so you said, like, they can assess you either in the community clinic or acute care or hospitalist. So if I get a sponsor, and let's suppose if I don't want to go for the acute care, can I decline, or is this mandatory to us? They are going to assess in all these fields or just one where I'm working?
So wherever you apply matters. So if there is a form, sponsorship form that is filled by your faculty who is sponsoring you.
Okay.
If it is a clinic, if it is Alberta Health, if it is CPSA, they're gonna fill out the form for your job, and that form has options to click.
Okay.
Whatever click is there, you will be assessed in that field for sure. Like they're not gonna leave you. And if you quit later on that you don't want to be assessed in that because you're not planning to work, you might need to redo your application for sponsorship in that particular field where you are planning to go and work.
Okay, great. Thank you so much. Really appreciate your help. Thank you.
All right.
Dr. Nasir Shah, I would like you to answer a few questions of the trainees that they've written in the chat box. One question is, what about Karachi? Do the Karachi citizens have to come to Lahore for residency?
Why you want to come to Lahore? You will do residency at Holy Family Hospital, Karachi. And we are looking for more avenues for training.
And another question is, currently I would like to mention, Dr. Nasir Shah, that we have a trainee in Karachi, Dr. Maz, and in the next batch we have registered another one. So another question is that I wanted to know, how would the teaching be? I mean, will there be calls?
Night calls. Yes, when you are part of a team, for example, surgery, you have to follow their schedule, because appendicitis, surgical emergencies, they do not land up in OPDs. There's no time for any emergency, abdominal emergency. So yes, in those rotations where it is essential, you can be part of the team and you can do night calls. But sometimes there are OPDs, like psychiatry is an OPD, no need to do the calls. Emergency shifts, no calls, the shifts, morning shift, evening and night shift. So especially gynae has no time, delivery has no specific time. Surgery and gynae are essential, sometimes medicine also. And family medicine is all OPD.
But it will definitely not be as hard as the house job, trust me. We all have nightmares of that time. It's not that time. So another hand is raised, which is Dr. Munib Majid.
I think Dr. Bushra Jawar before
Yes,
Dr. Munib.
yes. Thank you so much. Nasir, my question is that you mentioned very amazing thing, blended program, online learning. So we are on board for everything. My question was that is it possible that the 2-year training, if we do extensive study online, very quick, all of those exams and everything, whatever you're offering, so can we complete 2-year training in 1 year? That's my question.
It's a blend.
No.
It's a blend. A
Yeah.
blended learning. Online is one component. Attachment is another one. Workplace-based assessment and reflective learnings and portfolio. So one component does not substitute the other. And the other is you can't do double jobs. The duration is essential. You can't squeeze it, the 2 years stuff into 1 year. It will still be called 1 year training.
And blended means when we say that, is that possible that we do 1 year in Pakistan and or 6 months in Pakistan, 6 months in Canada, because I live here. Is it possible?
That's called flexible. That's not blended, that's flexibility. Like for example, I give you one practical example. One of the PGs in Lahore, she had some problems and she had to go back to Gojra. So we immediately arranged an hospital in Gojra and she shifted to Gojra from Lahore. That's flexibility in accommodation that we give to the PGs.
Okay, so with that, there is a possibility that you can be flexible in that way. Okay.
Yeah, and it's a case to case, depending on how genuine the issue is.
Yes. Okay. Thank you so
It's
much.
not a tourism, training tourism.
No.
It's out of necessity.
I have till now in case family emergency and family problem. In that case, yeah, obviously, no tourism. Thank you so much. Thank you.
Dr. Bazna Sayal has to leave. She has some schedule planned. So if any question is related to her, please ask that, and then we can better farewell.
I have questions from Dr. Bazna Sayal.
Dr. Mubasir, sure.
Okay, so I want to ask, like, first of all, like, after finishing the family medicine residency program in Pakistan, do we need to do observerships in Canadian system, like for a period of 3 months or so, or like, is it enough like to have a training from Pakistan and then directly go for the assessment? And the second question is, like, can she shed some light on the clinical assessment part? Like, what are we supposed to do? Are we supposed to to see all the patients independently and write the prescriptions and document at the same time, or how the clinical assessment looks like? Thank you.
Thank you so much. I was actually waiting for this question to come because that's what's probably what particularly my field is about. So his first question was about, like, do we need to work as or have some clinical experience once we enter in Canada in order to pass assessment? Absolutely, I agree with that. There is a big difference in the training that you get and then practice, and especially you are relocating yourself from one country to another. There is a huge cultural difference that you come across. You have to kind of like match with the requirements what are here. That's I see a lot, like people struggle once they come in and they're not able to successfully finish their assessments, is because they were not aware of that. So they have like a lot of challenges, and how to come over that. We are kind of like in a process to get that sorted out. We have like many volunteer people working for that and organizations who help people coming from other countries, and they are trying to get enrolled in the system, and they're preparing for their assessment. So make sure there is one advice without any doubt that I will ask all the candidates who are actually planning to enter in the assessment programs is, like, never ever do that without working in that environment where you are planning to get settled in. You're going to be facing a lot of challenges, and that becomes so difficult once you already have started the assessment and you are not aware what kind of program is that. So assessment is like you will be working as an independent physician, absolutely, like 100%, and your work will be assessed by your supervisor. So there is no help. Make sure you know that it's not a teaching opportunity for the assessors. It's an assessment program. So they don't teach you, they don't guide you. They might help you a bit about like, what should I say, like new services or like, the common facilities in the town where they are more aware, but they're not teaching you what to do in the clinical field. Say, for example, you learn driving, but when you enter in different territory, people might tell you, these different addresses and how to go to different places, but they're not telling you how to drive. That's a huge problem that the people who are coming in here, they're having significant deficiencies in particular fields that they're not aware of, and they enter in the assessment programs and they suffer a lot after because it's a huge setback for them. Wherever you are going to apply for assessment or looking for a job opportunity there, especially in Alberta, there is no on-hand training programs. So there are many people who are helping people coming from different countries as like volunteers. So you need to come across and, join certain organizations, try your maximum to seek help and advice from them. And exam is not a big deal. You read your books, you're done. But you're not done when you're actually entering in the assessment programs. It's a huge difference in between like taking exam and doing the practical work in the field. So I can have a little bit more in detail conversation about how the parameters like CPSA suggests for people to like what are the parameters on the basis of which we are actually assessing the people who are coming in. But like a lot of work for thing. But for now, I would suggest is yes, this is mandatory if you want to pass successfully first attempt, do work wherever you land in, especially in Alberta. In BC and Saskatchewan, there are some training programs. Unfortunately, not in Alberta. Did I answer both your questions, my dear?
Yeah, thank you so much, Dr. Syal. But I just want to know, like, how much of, how many months of observership should be adequate? Like, what would you recommend? Like, is 3 months, like, is this something like
You
that
know
should
what?
be
Like
enough? Or
I have people coming to me, and everyone is different, right? There are many people who will be okay by working like couple months, they're ready. But there are some people they might need like several months to get ready. So it's hard to say, but on an average, I would say at least 3 to 4 months probably is the minimum. They keep in mind like you should be working that many months for sure.
Okay, that's great. And Dr. Syal, like, in the clinical assessment, like, how many patients are we supposed to see in a single day? Like, and what about the documentation? Are they expecting a detailed, like, soap note from us at the same time as we are seeing the patient, or like, there is some margin on the documentation part?
How many patients? There is no guideline for that. Mostly CPSA recommendation is about like on day one, when you are actually assessing the work is like on day one, they should be able to see at least 8 to 10 patients independently. And that's not a big number as long as you are aware of how to do the things and how you're going to work in it. You gradually
Wonderful.
build up the number of patients with that. And the soap note and documentation, there is no restriction that you have to finish it while you are with the patient. You're going to be given like some extra time to finish that. You are given your home access, like of the EMR, that you can finish your paperwork at home as well. So not a big deal regarding that, but like that's one of the most strict field in people for people because they are not used to of doing documentation in back home, so they suffer a lot in that. So you need a lot of practice in writing a good soap note for patients whom you get interaction with.
Oh, okay, wonderful. And
Thank you so
one
much.
last thing, Dr. Syed, like, are they assessing like directly, like they're on the top of your head, or like they are just observing you from some distance, or they're seeing you like from some other room, or what kind of assessment is that?
It's directly with you. The person who is assessing you will be standing with you.
Okay, okay,
Thank you,
sounds great.
Dr. Mubassir. Dr. Badna and Dr. Samreen also has to leave because her son is not doing well. So we'll just bid her farewell. Thank you so much, Dr. Samreen, for your time.
Excuse me, can I have one question, please? From
Dr. Samreen,
Basha
are
or
you,
Wasia?
Yeah, thank you so much.
Dr. Hosia, one last question from Dr.
Nagmi,
Nagmi. Yes,
yeah,
please.
there is recently Ontario has announced a PRO program, and in their requirements they say that either 12 months of residency and 36 months of currency of practice. So the residency will provide us the currency of practice, or it has to be separately independent practice.
No, residency will provide you the currency of the practice. Yeah.
Okay, thank you so much.
Thank you so much, Dr. Hosia, for your time, for being here. Thank you so much. I know your son's not well and still you came. So we'll bid you favor. Thank you so much.
Thank you so much
everybody.
for inviting me. Thank you. Bye.